You've been passionate about the need to address mental health in kids. You and I have had several conversations about it over the past 20 months. The Surgeon General recently put out an advisory on mental health in adolescents, saying it's a crisis. And just some numbers for our audience, that 100,000 kids, more than 100,000 kids, have lost a parent or a grandparent from COVID, a caregiver, that the numbers of kids with anxiety and depression have doubled. Suicide attempts are up by almost half. You've talked to parents many times over the past few decades about how do you bring up concerns with kids? How do you talk to kids? When do you know when to get help? Now more than ever is where parents need guidance. So what do you tell them? Because the parents themselves, we've just talked about, may be suffering, and now their kids are. That would not be surprising.
Well, it's very likely if the parent, the most powerful role model in any child's life is the same-sex parent. Second most important is the other sex parent. So if you've got parents that are struggling emotionally, they may very well be sharing that stress, that anxiety, that depression, either through modeling or just because those stressors are present in that home, it might be translating to the children. So you could have a little bit of the blind leading the blind in this regard. But it starts with the parent knowing what the warning signs are to look for. And you have to look for sleep disturbance, changes in grooming, changes in aggressive behavior, withdrawal from things that the child was doing before, or any types of regressive behavior where they start functioning as they were at a younger age, whether it's back to bedwetting or less verbal skills than they had, being more clingy or whatever, any of those things that in pattern, now it could be a day or two, but if we're talking about in pattern, then you should take note of it and let that be a warning sign to you that the child might be struggling a bit. And again, I say talk about it and give it a voice. And I always tell parents to talk to their children about things that don't matter. It's kind of like, people watching this probably watch a lot of medical dramas, and what's the first thing when they go into the ER, they say, start an IV with Ringer's lactate. They don't know what that means, but they're just getting a vein open. So when they decide what they need, they've got a vein open. That's what I mean when I say talk to children about things that don't matter. You've got the corridor open. You've talked to them about their video games or some TV show or the dog or whatever. Because if the first time you ever sit down to speak to your child about something important is the first time you've ever really sat down to have a conversation, it's going to be tough. But if you've been talking to them about just anything, and now this time you're putting something in the channel that matters, it's not so difficult because that channel's open two ways. You've been talking. So hopefully that channel's open, and you need to talk to them and say, tell me how you're doing right
Say the
now.
channel's not open. Or a lot of adolescents, just because of adolescents, they don't talk much to their parents. What's the next step that parents should do?
They may not talk much, but they're always listening and they're always watching. And I really recommend that parents not do what you and I are doing right now. Don't put a child down in front of you and say, how are you feeling? Because now they're going to feel like, oh my gosh, I'm on the hot seat. You're better off to do it while you're shooting baskets or walking the dog around the block or anything where the child doesn't feel conspicuous. And it's really helpful sometimes to use a personal example. If you can say, boy, I tell you, I've been having a lot of trouble sleeping lately, or I've found myself feeling kind of nervous lately. My stomach flutters or something, and I'm not sure what it is. I don't know. How about you? Oftentimes, it's a principle of reciprocity. You get what you give. And if you engage the child in a self-disclosing way, then there's a good chance they'll reciprocate the same way.